Hi, my name is Jin. So I'm working as a psychosocial coordinator in Women's Day organization. By profession, I'm a practicing clinical psychologist.
Hi, my name is Ardi Aidali. I'm a volunteer with Befrienders Kuala Lumpur, and I'm also the publicity director for Befrienders Kuala Lumpur.
Okay, my name is Reena Rao. I'm a psychologist. I'm trained in clinical and counseling psychology. I primarily work with crisis patients.
We definitely see a trend in the need for mental health services in the past 18 months, especially since lockdown restrictions have gotten tighter. Then you will see that there has been a lot of people reaching out to seek for mental health support. WAO, even though we don't provide mental health support, but we definitely see a trend of people reaching out to Women's Day organization requesting for mental health support, and this has exacerbated if they were exposed to any sexual and gender-based violence.
We have noticed that there are more people who actually call in who are feeling suicidal, and this figure is around 34% of the total calls that we receive. So that's quite an alarming number, because basically 1 out of 3 people who actually contacted us are feeling suicidal.
Over the past 18 months, I have noticed an escalation with suicidal ideation amongst girls and women, especially with the period with the MCO and the lockdown. So we're talking about anxiety and gender-based violence. We're talking about, intimate partner violence.
Generally, we see them feeling very scared. I think that's the first impression that we normally get, being a person working behind the calls and responding to crisis messages. We see them feeling scared because they suddenly feel like they have lost control, and the world seems very unsafe and unpredictable. So this is that's what's underlying all this: the stress, the symptoms, the fear that they have been exhibiting.
So there be girls and women who are in relationships. Lockdown, because they can't leave their homes, they can't leave their relationships. So they've been forced to stay in the relationships with their partners, not being able to leave, not being able to go anywhere, no safe havens to leave. Their partners are not leaving them. So they don't even have that space for them to be alone at home.
But if we were to pick on a trend, I think I will say that Women's Day organization has gotten a lot of inquiry lately over cyber-related crimes. I think with the world switching to being virtual and online, we definitely see an increase in cyber-related sexual crimes, and this includes emotionally blackmailing, or distribution of your private images, so threatening to release the images if you did not do something to your partner. So we see a trend in the increase of that, and that is very distressing. I think this opens up a whole new page about fearing for their reputation, because when you release images, we have had survivors whose images did not just get released to the public web or the dark website, but it gets released to colleagues, family, friends. So this is the most distressing part, really, that really got the survivors thinking, like, if this gets out, I really don't think I can live anymore. Yeah.
Because when someone is talking about ending their life, about things being so hard and they can't go on anymore, oftentimes it's actually very serious, and it's not just a way of people to actually get attention, but it's actually a serious cry for help.
So just being aware of their body languages, you would see it if someone has lost bodily autonomy, they will appear a little bit more timid than usual. So some signs that you could pick out, it's like them crossing their hands a little bit more often when they speak, as a sign of being really defensive and guarded.
If you notice girls are wearing long sleeves or they're covering up bruises, please go and approach them and ask them if everything is okay. I know now, because there are no schools are closed, we are not seeing more girls in schools. So that might be an issue and a problem. But talk to your girls, talk to your friends, girlfriends.
Withdrawing socially, definitely, as they have developed trust issues for the people around, towards the people around them. Also, another point to look at is that they have lost some sense of self-esteem because they feel like they do not have control of their body anymore, or they don't feel safe wherever circle they go. So watch out for changes in behavior and personality, I would say.
And most importantly for us is to actually not to judge them and not to brush them aside, and always take them seriously. Be more specific and just go ahead and actually ask them, I've noticed that you've been feeling a bit down lately. Do you want to talk about what's troubling you? To encourage people to talk more. It's important to know that help is available and you don't have to suffer alone. So please reach out for help. And if you do not have anyone around you, if you find it hard to trust the people around you, you can always reach out to Defenders hotlines, because our hotlines are 24 hours and all calls are private and confidential, and you can remain anonymous.
I want to say, please reach out. There is help. There is always help. Okay, there are people who can help you. There's always a light at the end of the tunnel.
Help is available. I really can't emphasize that enough. And a lot of times when we want to provide help, I'm speaking as a psychologist, I'm speaking as a person working with Women's Day organization. Help is always available, but we understand deeply that the first step is incredibly hard because there's stigma attached to seeking help. There is the fear and the loss of self-esteem attached to the individual. But I think that's what I want to keep emphasizing. That's what I think will be very helpful to spread out to the community, is that help is always available. There are people here, there are people in NGOs very willing to help you, assist you, and get you back on your 2 feet.